The turkey sat golden brown at the center of our family's Thanksgiving table, surrounded by all the traditional fixings and an atmosphere thick with judgment. I picked at the cranberry sauce on my plate, my appetite gone, partly from the lingering effects of last week's chemotherapy, partly from the conversation that had dominated the last hour. Honestly, Rachel, this whole cancer charade has gone on long enough, Mom declared as she carved another slice of turkey with unnecessary force. Missing work, canceling plans, all these mysterious doctor appointments. We know attention-seeking when we see it. My older brother Derek nodded sagely from across the table, his MBA apparently qualifying him to diagnose medical conditions. It's textbook middle child syndrome. Katie got married last year, now Rachel needs her moment in the spotlight. I'd been fighting stage 3 lymphoma for 7 months. 7 months of aggressive chemotherapy that had left me 30 pounds lighter, chronically exhausted, and dealing with neuropathy that made holding a fork challenging some days. 7 months during which my family had systematically dismissed every symptom, every treatment update, every request for support. Remember when she was 12 and pretended to have appendicitis right before Katie's birthday party? Aunt Susan chimed in, gesturing with her wine glass. Same pattern. Can't stand when someone else gets attention. The irony was suffocating. I'd been financially supporting this family gathering for 3 years running. The turkey they were eating? Bought with money from my freelance graphic design business that I'd somehow managed to keep afloat between chemo sessions. The wine they were drinking while mocking my fake illness? Purchased with funds from the emergency loan I'd given Dad when his restaurant started failing. You know what bothers me most? Katie, the golden child, dabbed at her lips with her monogrammed napkin. It's the timing. Right when James and I announce we're trying for a baby, suddenly Rachel has this dramatic illness. It's like she can't handle not being the center of attention. Dad cleared his throat, preparing to deliver what he clearly thought was wisdom. Your mother and I have been talking, Rachel. We think you should see a therapist. This whole cancer fantasy is obviously your way of dealing with some deeper issues. I set down my fork, my hands trembling. Whether from anger or medication side effects, I couldn't tell. It's not a fantasy. I have stage 3 lymphoma. I've shown you the medical records, the treatment plans. Oh please, Derek interrupted, rolling his eyes. Anyone can fake medical documents these days. And you've always been good with that computer stuff. The table erupted in supportive murmurs for Derek's brilliant deduction. Cousin Mike nodded knowingly, Uncle Rob muttered about kids these days and their drama. And Grandma Pat simply shook her head in disappointment. What they didn't know, what none of them knew, was that my treatment team at Metropolitan General included Dr. Elizabeth Chin, one of the youngest department heads in the hospital's history and a rising star in oncology research. The same Dr. Chin who'd been featured in Medical Journal Weekly for her innovative lymphoma protocols. The same Dr. Chin who'd taken a personal interest in my case after learning about the family dynamics affecting my treatment compliance. You know what I think? Mom leaned back in her chair, clearly warming to her theme. I think Rachel enjoys playing the victim. All these chemo appointments are probably just coffee dates with friends where she practices looking sick. The table burst into laughter. Actual laughter. At the idea that I was faking cancer. She does look awfully healthy for someone supposedly dying, Aunt Susan observed, squinting at me like I was a painting she was trying to authenticate. When my friend had cancer, she was completely bald and skeletal. Rachel just looks thin. Exactly. Katie clapped her hands together. If she really had cancer, where's all her hair? She's been wearing it in that same shoulder-length style for months. I touched my hair self-consciously. The wig I'd invested in after losing my real hair to chemotherapy. The expensive, natural-looking wig that had cost 2 months of freelance income but allowed me to maintain some dignity during treatment. Plus, Derek added, clearly enjoying his role as family detective, have any of us actually seen her at a hospital? She always has these appointments when we're not around. Very convenient. My phone buzzed. A text from Dr. Chin. Just finished reviewing your latest blood work with the team. Mind if I stop by your family dinner? I'd like to meet the people who've been questioning your diagnosis. I'd mentioned the family situation during my last appointment, when she'd asked why I seemed more stressed than usual. Dr. Chin had listened with the particular stillness that doctors developed when they were professionally appalled. Fine, I said quietly, looking around the table at their smug, satisfied faces. You want proof? You'll have it within the hour. The dinner conversation continued around me as I sat quietly, watching my family construct increasingly elaborate theories about my supposed deception. The wine had loosened tongues and emboldened opinions, turning my cancer diagnosis into their evening's entertainment. I mean, think about it logically, Derek pontificated, clearly enjoying his role as the family's voice of reason. If Rachel really had cancer, wouldn't she want our support? Instead, she's defensive and secretive. Classic signs of someone maintaining a lie. Uncle Rob, a retired insurance adjuster who considered himself an expert in fraud detection, nodded approvingly. I've seen this before. People fake illnesses for sympathy, money, time off work. Rachel's always been the dramatic one. Remember in high school when she sprained her ankle right before the SATs? Katie smirked, clearly relishing the opportunity to tear down her sister. Turns out she just didn't want to take them. Same pattern, fake injury to avoid responsibility. I'd actually broken my ankle in 3 places and taken the SATs with my leg in a cast, but facts had never been Katie's strong suit when a good story was at stake. What I don't understand, Cousin Mike jumped in, is why Rachel would choose cancer specifically. If you're going to fake an illness, why pick something so serious? Mom's eyes lit up with the thrill of psychological analysis. Because she knows we'd feel guilty questioning cancer. It's the perfect manipulation. Pick something that makes you look heartless for doubting it. The table murmured appreciatively at Mom's insight. I watched them pass around the sweet potato casserole, the one I'd made at 5 a.m. before my morning chemo appointment because Mom had insisted on normal family traditions, despite my treatment schedule. Plus, she's been using this illness to get out of everything, Aunt Susan added, warming to the topic. Missed Derek's promotion party, skipped Katie's anniversary dinner, couldn't help with Mom's birthday planning. Very convenient excuses. Each missed event had been due to chemotherapy sessions, follow-up appointments, or recovery from treatments that left me too sick to stand. But I'd stopped explaining after the 3rd time Mom accused me of scheduling conflicts for attention. Dad cleared his throat importantly. I've been doing some research online about factitious disorders. People who fake illnesses often start believing their own lies. Rachel might actually think she has cancer now. That's terrifying, Katie whispered dramatically. She could really hurt herself trying to maintain this fantasy. The irony was crushing. They were concerned about me hurting myself while I underwent actual chemotherapy that was systematically destroying and rebuilding my immune system. I'd spent the morning before Thanksgiving getting blood work to ensure my white cell count was high enough to risk being around their unvaccinated grandchildren. I think we need an intervention, Derek announced, clearly enjoying the drama of the moment. Call her bluff. Demand to see real medical records, not whatever she's cooked up on her computer. Great idea, Mom agreed enthusiastically. Rachel, if you really have cancer, prove it. Show us something that can't be faked. Before I could respond, my phone rang. Dr. Chen's name appeared on the screen, and I could see her car pulling into our driveway through the dining room window. Who's calling during dinner? Dad demanded, irritated at the interruption to his psychological intervention. My oncologist, I said simply, watching their faces through the window's reflection. She wanted to discuss my latest test results with the family. The table fell silent for exactly 3 seconds before erupting in skeptical laughter. You're what now? Derek guffawed. You hired someone to call and pretend to be a doctor? That's commitment to the bit, I'll give you that. Rachel, this is getting sad, Katie shook her head in mock sympathy. Paying someone to play along with your fantasy? How much is this costing you? Nothing, I replied, standing to answer the door. Dr. Elizabeth Chen doesn't charge for house calls when she's personally invested in patient outcomes. Dr. Elizabeth Chen? Uncle Rob's face went pale. He'd clearly recognized the name from his extensive medical research during his own recent health scare. The Dr. Chen who's head of oncology at Metropolitan General? The same Dr. Chen who was just featured in Medical Weekly for revolutionary cancer treatments, I confirmed, moving toward the door. She wanted to meet the family who's been so supportive during my treatment. Through the window, I could see Dr. Chen gathering her leather medical bag and a thick folder of documents. She moved with the purposeful stride of someone who'd spent the day saving lives and had little patience for the evening's planned activities. The dining room had gone completely quiet except for the sound of wine glasses being set down with unusual care. Revelation, 400 to 600 words. Dr. Elizabeth Chin entered our dining room like a force of nature wrapped in professional elegance. At 38, she commanded respect through competence rather than intimidation, but something in her dark eyes suggested she was prepared for both. She carried herself with the quiet confidence of someone who regularly delivered life-changing news and had little patience for games. "Dr. Chin," I managed, relief flooding through me as she set her medical bag on our china cabinet. "Thank you for coming." She surveyed the table with the clinical assessment that had made her the youngest department head in Metropolitan General's history. Her gaze lingered on each family member's face, cataloging expressions like symptoms. "Rachel," she said warmly, then turned to address the room. "I apologize for interrupting your holiday dinner. I'm Dr. Elizabeth Chin, Chief of Oncology at Metropolitan General Hospital." The silence was deafening. Dad's fork hung suspended halfway to his mouth. Katie had gone completely white. Derek looked like he was trying to solve a math problem that wouldn't compute. "I wanted to discuss Rachel's treatment progress with her support system," Dr. Chin continued, opening the thick folder she'd brought. "Though I understand there's been some confusion about her diagnosis." Mom found her voice first, though it came out smaller than usual. "There must be some mistake. Rachel's been, we thought." "You thought she was faking stage 3 lymphoma?" Dr. Chen's voice carried the particular chill reserved for family members who'd failed their patients. "I see. That's medically fascinating." She spread the first set of images across our Thanksgiving table, replacing the sweet potato casserole with PET scan results. "These are Rachel's pretreatment scans. As you can see, the lymphoma had spread to multiple nodal regions throughout her chest and abdomen." Uncle Rob, who'd been so confident in his fraud detection skills, stared at the black and white images showing tumors that were anything but imaginary. "This is her current blood work," Dr. Chin continued, producing lab results with the efficiency of someone who'd spent years translating medical reality for families in denial. "White blood cell counts, tumor markers, chemotherapy response indicators. All consistent with aggressive treatment for advanced lymphoma." Derek's face had progressed from skeptical to horrified as he processed the implications. "But she never looked sick enough." "Looked sick enough?" Dr. Chen's eyebrows rose with professional interest. "Could you elaborate on your medical training that qualified you to visually assess cancer staging?" The question hung in the air like a challenge no one was equipped to meet. "Rachel has been undergoing CHOP chemotherapy for 7 months. Dr. Chen's voice grew colder with each word. "Cyclophosphamide, doxorubicin, vincristine and prednisone. The side effects include severe nausea, fatigue, neuropathy and complete hair loss. She's been wearing a wig to family gatherings to spare you the visual reality of chemotherapy." Katie gasped, her hand flying to her mouth as she stared at my perfectly styled hair with new understanding. "Her 5-year survival rate with treatment is approximately 60%, Dr. Chin continued with surgical precision. "Without treatment, her life expectancy would have been measured in months. The fact that she's maintained her professional responsibilities while supporting this family financially during treatment shows remarkable resilience." She closed the folder with the finality of a judge's gavel. "I've rarely encountered a patient who's received less family support during such a critical treatment period. It's been professionally concerning." Dad's wine glass slipped from his nerveless fingers, shattering against our hardwood floor. The statistics hung in the air like a death sentence for their carefully constructed denial. Dr. Chin packed her files with the efficiency of someone who'd delivered more devastating news than my family would ever comprehend. As she prepared to leave, she handed each family member her business card with clinical precision. "Should you have questions about lymphoma, chemotherapy protocols, or how to support cancer patients," she said, her voice carrying the weight of professional judgment, "my office provides educational resources." The aftermath unfolded like a medical emergency in slow motion. Derek called in sick to work Monday morning, unable to face colleagues who'd inevitably heard about his Thanksgiving cancer diagnosis expertise. Mom canceled her book club meetings indefinitely after word spread through their social network. Dad's restaurant customers began questioning the judgment of a man who'd publicly dismissed his daughter's cancer. Katie's pregnancy announcement, planned for dessert, never materialized. Hard to celebrate new life when you'd spent dinner mocking someone fighting for theirs. By the following week, the family group chat had gone silent. The financial support they'd grown accustomed to, the emergency loans, bill assistance and holiday funding, disappeared along with their credibility. Turns out, questioning someone's cancer diagnosis makes it difficult to ask them for money. I finished my chemotherapy course 3 months later with Dr. Chen's team celebrating each milestone. My 5-year survival odds improved with every clean scan. My family's relationship odds, however, remained terminal. The Thanksgiving photos from that night captured everything. The moment medical reality crashed into willful ignorance, the instant a renowned oncologist educated a table full of amateur diagnosticians, and the precise second they realized they'd gambled their daughter's trust against their own assumptions and lost. Dr. Chen had done more than defend my diagnosis. She'd revealed exactly who my family was when I needed them most. Some relationships don't survive that kind of medical clarity. Some aren't supposed to. I spent Christmas with Dr. Chen's family, fellow cancer survivors who understood that strength looked different than they'd expected, and that real support came from people who believed you when you said you were fighting for your life. The turkey tasted better when surrounded by people who wanted me to win.